Apnea is one of the most common sleep disorders. Approximately 30% of Americans experience some symptoms. Hartford Hospital is now trying to help, and they have some exciting news. They just celebrated the 200th Inspire therapy procedure for obstructive sleep apnea. This is really an intricate system that helps your body with its natural breathing process. So joining us today so we can understand more is Hartford Healthcare's Dr. Carl Moeller, an ear, nose, and throat specialist with Hartford Hospital. Thank you so much for being with us.
Thanks for having me, Carrie. I appreciate it.
Yeah, so what exactly is obstructive sleep apnea, and why is it so important that we treat it?
Sure, great question. So sleep apnea is a condition that leads to a temporary blockage in the airway. This causes a patient's breathing to be disrupted and can lead to a drop in oxygen levels at night.
So I think we've seen ads for this. I understand you have performed the 200th Inspire therapy procedure at Hartford Hospital. Can you tell us about Inspire, what it is, how it works?
Yeah, absolutely. So sleep apnea, as you said, is extremely common, affects over 20 million Americans. First-line treatment is CPAP, which is essentially a mask that blows air into your mouth and nose, stents open the airway. Only about 60% of patients can tolerate CPAP real well. Inspire is a surgical alternative to CPAP. It's for patients who can't tolerate CPAP. So it's an outpatient surgery. It takes about 2 hours. It involves 2 incisions, an incision in your neck and in your chest. And essentially what it does is it picks up when you're taking a breath through a breathing sensor in your rib cage and sends a 2-second electrical pulse to the tongue, which causes the tongue to stick out a little bit and stiffen and prevent the airway from collapsing.
Ah, okay. So who is eligible for Inspire therapy, and how do you know if it's right for you?
Yep, good question. So patients with moderate to severe sleep apnea are candidates. There is a weight criteria, so you have to have a body mass index below 35, and you have to have tried CPAP. You have to have tried and failed CPAP prior to being a candidate. But like I said, about 40% of patients don't tolerate CPAP real well, so this actually leaves a lot of patients out there who would really benefit from this procedure.
Okay. And the Inspire therapy system is minimally invasive, so I know patients can learn more about what they might be able to expect. You've got a lot of information on your website, so we want to drive people there. Thank you so much for being with us.
Thank you so much for having me. I appreciate it.
And for more information, you want to learn about this, maybe you're a candidate, you can visit the website. It's hartfordhealthcare.org/neuro.